Congressman Paul Ryan has made it clear he will vote against the health care reform bill. This week, he spoke with the MacIver Institute to explain why.
My biggest problem with this bill is I believe it represents an inevitable takeover of the government of our healthcare system. I don't think that is the way the world works well. I believe this bill is designed to incrementally, in a handful of years, have the government become essentially the single payer of healthcare. And the only way to contain costs under that kind of a structure is to put the government in the position of having to ration care based upon costs. That is not where we want to go with healthcare in America. That is not the principles that founded this country. So what I see this bill represents is basically turning the principles that built America, individual freedom, liberty, choice, competition, free enterprise, self-determination, throws those principles out the door and puts in place the kinds of principles you see on display in Europe. And I think the practical result of this kind of legislation will be to accelerate our trend toward a welfare state. And I don't think America should become a social welfare state like you see in Western Europe. Unfortunately, if this bill becomes law, I think it will hasten the day when America becomes a social welfare state.
Thousands of people attended Ryan's town hall meetings this past month.
I've never seen anything like this. I mean, really, I've been doing lots of these town hall meetings. I've done about 475 town hall meetings now. I have never seen this. I have people coming up to me with the copies of this bill, highlighted, dog-eared. They've read it. They've looked at it. This is real citizen involvement. This is organic. And I find some in the media, in the left, keep thinking, well, this is just the Republican Party turning out its supporters. Look, they're giving us more credit than we're due. They think we're not that organized. But what I see are citizens really being concerned about what's going on in society. It's not just health care policy. People are worried that this puts the government in charge of health care. It's going to limit their choice. It's going to limit their options. It's going to cause really high taxes. It's going to give them cookie-cutter medicine, health care rationing. It goes much beyond that, though. This goes beyond just bad health care policy. And people see this as really what is the role of government in our lives in America. And so people look at the fact that we had the auto company takeovers. You had the stimulus package. You had the omnibus package. You had the budget that doubles and triples our national debt in 5 and 10 years. So people see the government involving itself in the economy and in people's lives in ways they've never thought imaginable in America. And now you have this after cap and trade. And I think people are really worried about the direction of the federal government in America today and their relationship as individuals with their government. And that is what is turning out people by the thousands to these town hall meetings.
With so much interest in this issue, rumors are flying.
I don't know if I'd say there's one single big misconception. I think there's been embellishments on both sides of this issue a little bit. Every issue gets urban legends that get perpetuated through. And so there are some urban legends surrounding this issue on both sides, from the right and the left, that I think get perpetuated. People read it on the internet, they think it's fact, and therefore they move forward with it. That's kind of common with those issues. I think the biggest misperception are from the advocates of this bill. The biggest misconception of this issue really is the rhetoric that the president and Democrats are using. Choice, competition, if you like what you've got, you can keep it. It's sort of free market rhetoric designed to sell an inherently anti-free market plan. And so the biggest misperception is people who listen to the rhetoric to sell this health care bill, when they look at the substance of it, the substance doesn't track with the rhetoric. The substance of this legislation is 180 degrees opposite of the rhetoric that is being used to sell this legislation. So what's happening is the president and Congress are using free market rhetoric to sell a plan that is designed to destroy the free market in healthcare. That, to me, is the biggest misperception. So those who just believe the rhetoric often find out that the substance is completely opposed to what that rhetoric says.
Ryan has written his own bill addressing healthcare problems, but Democrats have told him it will never see the light of day.
The most important thing about healthcare I'd like to see changed is to equalize the tax treatment of healthcare. That does a couple of things. It gives everybody the same playing field on how to go out and purchase health insurance, but it also goes at one of the root drivers of health inflation. It helps us get the uninsured insured, and to me, that's one way of bending the cost curve of health insurance. That's just not my opinion, but economists from across the spectrum believe that if you equalize the tax treatment on healthcare, you can get the uninsured insurance, and you can reduce the health inflation that is pervading in the system.
For the MacIver Institute, I'm Bill Osmolsky.